You're watching WDEF News 12 this morning with Rachel Esch, meteorologist Brian Smith, and your time-saver traffic tracker with Sunny 92.3's James Howard.
We're so glad you're waking up with us here at WDEF News 12 this morning. It's time for house calls. We're answering any asthma or allergy questions. Dr. Susan Rochelle is here to answer those at 756-1212. 756-1212 is the number. We're going to get right to the callers because we have quite a few. James is on the phone lines for us this morning. Hi, James.
Hi.
Good morning.
My question is, I got a 7-year-old.
Okay.
Hello.
We can hear you. Go ahead.
I got a 7-year-old daughter with asthma.
Yes.
And she had to come home from school one day this week. And they thought it was ringworm.
Okay. Where was it?
And I was wanting to know if when she has an outbreak like it, what can I do about it? Because she's taking her medicine like she's supposed to.
Okay.
And I called the nurse. They called me at work. And
Okay. That's a really good question. You know, and lots of people who have asthma also have something called eczema or atopic dermatitis. And sometimes that patch of dry skin looks just like ringworm. And so one of the things that needs to happen is you definitely need to have that looked at by a doc to identify whether or not it's ringworm, because if it truly is ringworm, it needs to be treated with a completely different medicine, an antifungal medicine. And if it's eczema, then what needs to happen is it needs to be moisturized and possibly treated with a topical steroid. So the first thing is to identify what it is. And the best person to do that is going to be probably her primary care doctor who can do that. But you raise a really good point because eczema can be associated with asthma. In fact, it frequently is.
Let's go to Irma now. Hi, Irma.
Good morning.
Good morning,
Irma.
I want to know, do you necessarily have allergies when you have like a cold and it just constantly, your nose is always running and your eyes and all this?
Yes, that's a good question. So eyes running, nose running, sometimes that can be an allergy, sometimes that can be an upper respiratory infection, like you said, a cold. Colds are usually due to viruses. Now, generally, if it's colored, so if it's green or if it's yellow, it suggests infection. It doesn't distinguish bacterial versus viral. So for the first few days, it's probably going to be a viral infection. And that, of course, you just let it run its course because antibiotics don't treat viruses, but antibiotics definitely will treat bacterial infections. So if the symptoms, colored discharge, last for more than 7 to 10 days, then an antibiotic would be helpful. Meanwhile, if the symptoms are increased when the pollen is increased and you have itching of the eyes and one other area, in the nose, in the ears, the roof of the mouth, and you sneeze several times in a row, then that's frequently associated with allergy. But there is another condition out there where the nose just runs due to weather changes and barometric pressure changes or irritants, and that isn't an allergy, but we treat it just like allergies, where antihistamines and nasal sprays usually do the trick to treat that.
Some good tips to know the difference there in a cold or an allergy. Let's go to Kathy quickly. Kathy, your question.
Yes, I've been having a lot of eye trouble, itching, watering, and I'm taking Allegra, and I was wondering what else I could take to stop this.
Right. Another great question. And the thing about that is this. Itching, like I just mentioned, is usually associated with allergy. So if you have itching of your eye in one other area, then it suggests allergy. So Allegra is a great choice. But it's not always all that we need. Sometimes you may need an eye drop, and there's specific eye drops to treat allergies that can be triggering eye symptoms like watering eyes or itching eyes. The other thing is that there's nasal sprays out there that can also help treat, believe it or not, eye symptoms. So nasal spray, in fact, nasal steroids are the single most effective treatment for allergies. And so that would be the next thing that I'd recommend, is an allergy nasal spray that will help with your symptoms. And if that doesn't do it, then you can try the eye drops, and if that doesn't do it, then come see us.
Let's put the information on the screen, and here's how you can get a hold of Dr. Susan Rochelle. She is on Mackey Branch Drive, and it's Covenant Allergy Clinic, and here's the number to call, 844-668-3261 or covenantallergy.com. This is a live look at the website for you this morning. All the information, dates, times, and all that are right there for you. So check it out and go see her. She can definitely help you if you're suffering. Stay with us. We'll take a short break and be right back.